Well, each year, around 350,000 Americans undergo hip replacement surgeries, and that's why Sharp Memorial Hospital just opened a hip preservation clinic, hoping to keep patients out of the operating room. Here to tell us more is orthopedic surgeon Dr. Mahi Trivellas. Dr. Trivellas, thank you so much for being here.
Thank you for having me.
Well, this is wonderful news because Sharp Memorial has been a pioneer for hip surgeries and replacements over the years. So this new clinic just opened, and it's at the James S. Brown Pavilion, which is the former outpatient center.
Yes, exactly. They actually still have the outpatient surgery center just below, but it's perfect location.
Okay, so tell us the purpose and the goal of this new clinic.
So the hip preservation clinic, again, as you mentioned, is to treat patients all the way up until they need a hip replacement. So hopefully to avoid any hip replacement or any extensive surgery like that. But there are other things that we can do to address certain injuries or, pain or symptoms that can come up prior to needing.
Let's talk about some of those procedures that will be offered at the clinic.
Yeah, so, obviously basic just intake history, patient education is huge. I feel like, patients know either you have a hip replacement or you break your hip, but they don't know a lot of the education that, leads up to those procedures. And so you can still have traumatic labral tears. You can still have just difference in your anatomy that causes instability. And so we offer patient education first and foremost. And then physical therapy and injections can sometimes help get you over the hump if you had, an acute trauma or just some inflammation, and then help with building, strengthening back up afterwards. And then also, when it comes to surgery, even if it's not a hip replacement, there are still some ways that we can intervene surgically prior to that. And that's if you do have a labral tear, you can do a labral repair. You can shave down some of the bone that can kind of pinch up and cause what we call femoral acetabular impingement, which is just impingement of the femur bone and the acetabulum part of the pelvis that can put the soft tissues at risk for injury.
Interesting. So let's talk about the function of the hip. When I was driving to work today and I knew I was going to be interviewing you, I was thinking our hips, they go through so much. They hold so much stress. You have the two joints that support the legs and hold the body. Let's talk about the function.
Yeah, no, I think that's a huge part of my practice is just education, because we were talking a little bit about earlier, but everyone's anatomy is a little bit different. So your pelvis is shaped in so that it can cover your femoral head, and then you can weight bear and do all your activities. But that coverage is very variable per person. So you might have a lot of lateral coverage, you might have a lot of anterior coverage, you might be retroverted, and you might actually have less anterior coverage or less lateral coverage. And those differences play a huge role when you're super active. If you don't have enough coverage, you can have instability, pain, soreness, and it's really life-altering.
Yeah, anytime you think of hip procedures or replacements, you think of the elderly, because over time the impact on your hips, but that's not the case, because even young people are having issues with their hips because of sports and athletics.
Exactly.
And speaking of athletics, so you are an expert in sports medicine. You played lacrosse at Yale University, and you ran track and field hockey in high school. That's pretty incredible too. So what have you seen as far as the younger generation needing hip procedures because of the impact from sports?
Yeah, absolutely. And it's not just lacrosse or field hockey. In fact, certain sports are predisposed to having more issues with your hips. So gymnastics, cheerleading, a lot of people that go into those sports because they're super flexible and they're successful. That's actually because their anatomy is shaped differently, and they may have issues with hip instability or hip dysplasia. So that's a huge part of the younger population that we see. And then in addition to the hip dysplasia, there's also what I mentioned before, that impingement syndrome. You can have extra bone on the femoral side, which we call a cam lesion, and that is seen a lot of times in hockey players, rugby players, people that are in that crouched position, and it's because their hips are feeling the stress of those positions, and so it can lead to injuries. Again, maybe they're strong and in the moment it's no big deal, but they have that one misstep, one tackle, one tweak, and then it's just hard to break the cycle after that. So that's where we intervene.
What a great discussion talking about hip preservation in this new clinic at Sharp, because many people need to think about these things, and maybe they don't want to go to the extent of having surgery or hip replacement. So it's great to see some alternatives. Dr. Trivellas, thank you so much for your time. Pleasure meeting you. And we'll have the story on our website, KUSI.com.
My pleasure. Nice
Thank you. Of course. All right, Logan.